was basically, to thank everybody, who has accepted and make it, for this discussion. It was not an easy task, as you know, from we have people from the east to the west on different, time frames. So it's a difficult, but they make it, and this is very important, for us, and also for the discussion that we will take to have a global view on the situation of water in this framework of the COVID pandemic. I thank everybody. I thank also those that they are attending the meeting. We were not expecting that much, requests, but our target at the beginning was 500, and we are over that number, and it had, to include more space for other participants to reach the discussion and participate to this discussion. So thanks everybody on the name of UNESCO, but also on the name of the Water Division, and that's it. Thank you. Thank you very much.
Well, good morning, good afternoon, good evening, ladies and gentlemen. Welcome to this webinar, which, as was mentioned by Annick, indeed is of global nature, as we go across all time zones, and within that time issue, we have 90 minutes to discuss an upcoming and very important matter. Well, those of you who are coming from the water world certainly are familiar with the notion of a looming water crisis, which the profession is crying about now for nearly 30 years. And luckily, the political community finally listened to that cry. And water is indeed one of the central pieces of the Sustainable Development Goals, if not the central piece. There are some who argue, and well, perhaps I may say that I'm one of those, who argue that water is not only the centerpiece of the SDG, the 17 SDG goals, but it connects all of them. Because if you take out water, then the whole system is collapsing. So far we were basically busy with handling this water crisis, but now there's another crisis that is being superimposed on the water crisis, and that's the crisis of the COVID-19, which is unusual in its proportions. It's really global, and it's moving very fast. So that is what we will discuss, whether is there a connection between the two crises? How water and COVID-19 are being connected. Are they connected at all? And if they are, what is it what we should do in the coming years to change how water is being governed? How do we tackle the water crisis with this new additional challenge? We assembled a fantastic panel. Each of the panel members will talk for about 5 to 6 minutes on the most important issues. And right at the beginning, we will have some questions which we would like to pose to the audience, yes and no questions, and then, or answers rather. And then at the end, we will see how people believe or what they think of the big issues related to water and climate. And I think, Annick, you have those questions prepared. The first question is water security in the age of COVID-19 is the title of our webinar. So the question is, do you think climate change is one of the drivers of COVID-19? And we just check yes or no. And at the end of the webinar, we will summarize the lessons. Without any further ado, however, let me turn now to Professor Daniel Brooks, who is a professor at the University of Toronto in Canada. He's a professor of ecology and evolutionary biology. He's a well-known expert on this pandemic issues and the widespread distribution of viruses as they are linked to to climate change. So the questions which I would like to ask Daniel to cover is basically to give us a short background and the nature of the current pandemic, and whether the risk of future pandemics and emerging infectious diseases is greater than they were in the past. And last but not least, and this is of course is the big issue. Again, the linkage between climate and the pandemic. So I would like to give the floor now to Dan Brooks. Dan, the floor is yours.
So yes, in a short period of time, to just set a little bit of context, when we speak about the emerging disease crisis, it's important to realize that we're not just talking about a small number of headline viruses in human beings. What we're talking about is a global phenomenon of emergence of infectious diseases caused by all kinds of pathogens in humans and in livestock and in crops. Before this COVID pandemic, production losses and treatment costs for emerging diseases across all of those groups amounted to, on an annual basis, amounted to more money than the GDP of all but 14 countries on this planet. So even before the COVID outbreak, the emerging disease crisis was already extraordinarily expensive and most likely unsustainably expensive, because our reactions to emerging diseases have all been crisis response, and there's been very little in the way of proaction, prevention, anticipate, what we call anticipate to mitigate. The thing that we've been surprised about is to realize that there is not a widespread recognition of a connection between climate change and emerging disease. For evolutionary biologists who've been working in this area for 20 years, that connection is clear, but we didn't realize until very recently that in the health areas, this connection is not really understood very well. And it's actually a very simple but fundamental connection. And that connection is that what global climate change does more than anything else is that it allows things to move. It creates the opportunities for all kinds of organisms, including human beings, to move around. And in those movements, we have increased opportunities for pathogens to come into contact with hosts that are susceptible but have never been exposed before. And so it turns out that climate change provides a very general, fundamental framework for allowing us to understand that there will be many, many, many emerging diseases, not just few. And in that sense, we have to understand that both the risk space for emerging diseases on this planet is enormous, but that it's also accelerating. The number of opportunities is increasing, and the number of emerging diseases is increasing as well. In the case of COVID, there is not a direct connection between climate change and this particular outbreak. There is this background general connection that human beings have an interface with wildlife. In the case of the Wuhan live animal market, for example, this is a situation in which relatively urbanized human beings come into contact with many species from the wildlands in a context and interface where the possibility of pathogen exchange can occur. So it turns out that the fundamental connection between climate change and emerging diseases is accelerated and amplified by things like global trade and traffic, global transportation, people moving around the planet. All of these things simply increase the number of opportunities for pathogens to come into contact with susceptible hosts. So that we now find, for example, that the spread of COVID around the planet is one problem. The spread of COVID in human beings around the planet is one problem. But even more fundamental is the fact that we missed the opportunity 3 or 4 months ago to begin monitoring for COVID to move into non-human reservoir hosts in the new countries where the virus was introduced. And so we must now assume that COVID is going to become an established new component of what we call pathogen pollution in most of the countries where there has been an outbreak of the disease. With respect to what little knowledge I have and no actual expertise about water, beyond the fact that all parasitologists are trained to understand that water is the most important component of parasitic diseases. With respect to COVID, we do know that other coronaviruses can be transmitted in the feces of infected organisms. And that means that it's important to understand the relationship between COVID virus or coronaviruses in fecal material and things like water treatment. In many privileged countries, people are being told to wash their hands continuously and wash surfaces and keep things clean. But in many countries, you either do not have enough water to do that, or the water that's available is polluted and contaminated to an extent that washing your hands all the time would actually create other problems. So the issues of water treatment, the issues of water supply and water quality apply to how we would try to attempt to mitigate this pandemic that we were unprepared for and should have been completely prepared for, since the virus was known since 2005. The potential for zoonotic outbreak was known since 2007. And this particular outbreak was not only anticipatable, it was easily preventable. Had there been a better coordination between basic science, health policy, and governmental policies, which is always a background in any of these areas. And I would simply close by pointing out that as unpleasant as this COVID pandemic is, it's a baby pandemic, and it caught everybody unawares. We now know that the public health infrastructure globally is not up to dealing with even a mild pandemic like this. The global financial system, global trade system is not up to coping with, it's not robust enough and resilient enough to cope with things like this. We are now speaking of, at the moment, I think the current estimates are something like between 300 and 400,000 deaths from this particular pandemic. If we were speaking of a pandemic on the magnitude of the Spanish influenza pandemic of 100 years ago, we would be speaking about 750 million deaths rather than 400,000 deaths. So in some ways, we should consider ourselves lucky that we are dealing with a pandemic that allows us to learn from our mistakes and try to do a better job the next time, because there definitely will be a next time, and it will be sooner rather than later. Thank you.
Well, what was surprising this whole thing was the speed. In 4 to 5 months, the whole thing went around the globe. Well, if you recall the cholera cases way back in the 16th or 17th century, they were a lot slower because of the lack of communication. The transportation was different. Things speeded up now. Luckily, the technology has also speeded up. Nevertheless, what we are after in this discussion is indeed to see how climate and the pandemic are related. People say that 80% of the climate change will be manifested through, with, and by water. Now, and water in many regards is definitely linked to the pandemic, whether it's the hand washing or water acting as a vector. I would like to call now Professor Deepak Ivali, who is a member of the Nepalese Academy of Sciences. At the same time, Deepak is working at IASA, the International Institute for Applied Systems Analysis in Luxembourg, in Austria, and his field is water, energy, political economy, and as a former minister, he is pretty much well aware of the situations in countries such as Nepal. So the question, well, again, I would like to ask from Deepak is the linkage, the potential linkage between climate, water, and the crisis, the pandemic, and whether the tipping points such as deforestation are in any way linked to the COVID-19. Deepak, your show.
Thank you, Andras. Let me start right away with your question. Deforestation, I don't like that word. I prefer to call it habitat destruction. First of all, habitat destruction definitely has something to do with the closer, as the previous panelist also mentioned, the closer contact between humans and wild animals that carry all kinds of other viruses that we are not used to carrying. Just the other day with this lockdown, the news came that we had a pack of leopards moving around our main university gate in Kathmandu. Which they must have come down because nobody's walking around, so they thought it was just a jungle. But the fact is that we have encroached heavily into their areas. Okay? And so this is happening, and this contact is happening. The habitat destruction is contributing to it. But then, with climate change, the habitat destruction is a purely social and economic phenomenon pushing it. But with climate change, what is really happening is that there are all kinds of changes going on. It was created, climate change. The problem was created by, I keep saying, the energy sector, but the impact to society is through the water sector. Okay? With too much water, too little water, water at the wrong time, wrong place, wrong intensity, and so on and so forth. Monsoon coming too late or ending, much later than it should, not allowing crops to ripen or allowing to decay. All kinds. And in this change in humidity, the atmospheric content of water is definitely contributing to all kinds of, these microorganisms and bacteria and insects and God knows what else to find, a better habitat where it didn't exist before. And therefore, this pandemic definitely, I personally feel, has some kind of a link there. Now, where is the problem to my mind? And I'd like to talk about some of the solutions. First of all, a pandemic, like the water crisis, is a wicked problem, which means, not only is there no immediate solution, there isn't even an agreement on what created the problem in the first place. Now, the problem with this pandemic has been that, one sector's definition of the problem and its proposed solution, like with climate change, the energy sector's definition and solution. With this also, it's the health sector, the epidemiology sector, that proposed the problem and the solution. And the solution was lockdown, convert the entire world into a hospital, okay, and wash your hands multiple times a day for 20 seconds at least each time with water. The assumption behind it was that everybody lives in an upper middle class bungalow surrounded by nice gardens and fence. Okay, we have, as the crisis in India with this and in Nepal has shown, with the informal laborers, millions of them, having to walk back home to their home district 1,000 and more kilometers in India, and the same in Nepal. It turns out the governments and society at large, the chaturati class, media, were totally unaware that there is a huge number of very poor people in the informal economy, the laborers, working for a pittance, who are actually running our cities with their services. From the cleaners to the people who carry, stuff around to, people who run the transport and so on and so forth. Okay. Now, these people live, maybe 8 to a room, where the landlord provides probably, just enough water for about, say, 7 liters per capita per day. Okay? Where do they get the water to wash their hands, 7 times or 10 times a day for 20 seconds? Okay? So, and then when people are living at 8 or 10 to a room, it's a problem of the water sector. It's a problem of urban planning. And the solutions provided by these other sectors have never come into this debate. Okay? So I personally think that this is a forensic moment. Every disaster, every pandemic is a forensic moment if we are able to learn the right lessons. And to my mind, there are 3 major lessons that the water sector has to draw out of. First of all, this whole idea of clean water, we have to distinguish between clean drinking water for consumption, absolutely. And there are many ways of providing that bare minimum of 6 or 8 or 10, whatever liters people need for their internal consumption, versus the kind of water that is needed for washing, cleaning, etc., etc. The second is that the water is life. I think you also mentioned it. All 17, 18, all of the SDGs are related to water. Water is life. It's connected to everything, which means that we have to look at the nexus of the various chains on which water is involved. Okay? And start with the 2 most ignored, interestingly, aspects of water. From the top, the hydrometeorology, and at the bottom, the hydrogeology. There's very little going on in the understanding of what happens. Okay? This pandemic, Nepal, Kathmandu at least, has been lucky in that we have had very unseasonal extra rain in this dry season. This should have been a bone dry season. It's been raining every day. As a result, my wife has not had to buy water tankers. This is the first time in many years that she hasn't had to buy water tankers. She's very happy about it. But the fact is that this probably also has to do with climate change. So we have to look at the entire chain where water is linked, not just for consumption and economic activities, but also for health. What good is it to have clean drinking water at home when your child has to go to a school, or you professionally have to go and eat in a restaurant where the water is not good or contaminated? So this brings this nexus, transdisciplinarity and interdisciplinarity into much sharper focus than it ever did. And finally, the last third point is that we have especially the last 30 years since what is called the Washington Consensus, we began to treat water as a private good. Talk of public-private partnership at best and all, which is kind of wrong, because we need to talk about public-private civic partnerships. And in this, we have to talk about water not just, it is also partly a private good, but not just as a private good, but also a regulated public good, and also as a common pool good that is beyond even regulation. Okay? The water in nature, in rivers, in our urban cities, landscape, and so on. So we have to stop thinking of water only as a private good in our policy making, and talk of water as a private, public, and common pool good. If we rethink our public policy management around water, we will probably go a long way in facing crises like this, which is not going to be the first, nor will it be the last. Thank you.
So the next presentation is by Dr. Blanca Jimenez Cisneros, who is the Director General of the National Water Agency in Mexico. She's a former secretary of the Intergovernmental Hydrological Program at UNESCO, and her specific field is wastewater treatment, sanitation, climate change, and sustainable development. We know what a difficult job you are in, Blanca, right now, because Mexico is facing, like many other countries, a very severe situation with respect to the pandemic. So the question, what perhaps we would like you to concentrate on, is rather simple but very difficult to answer. Can the pandemic spread through water? And then, if time permits, if you could share with us, what are the current challenges you face at the helm of the National Water Agency with respect to this disease? Blanca, you have the floor,
well,
please.
Thank you very much, Andras. Good morning, everybody. First of all, allow me to tell you that was the question. I need to make myself starting this issue, this pandemic. Why? Because we need to put in practice measures to control any kind of risk. So what we found so far is that if the water has enough chlorine, there is no risk, first. Secondly, that a virus that spreads through the aerial pathway does not react the same when it is in water. So the risks are low. Even they have found pieces of RNA in the wastewater. The viable virus has not found in an active way for several days, even in non-chloride wastewater. So the risks are low, but still they are there. But so what was the main practical issues once established? That is the need to wash hands constantly. It's been stated by the World Health Organization that if people do hand washing, the risk of respiratory diseases reduced in 25%, a risk that must be higher when consider the COVID, the coronavirus, because they are much more infected. So we start putting in place in a very strategic way that addressing to supply proper kind of water to hospitals. That was our main concern. And let me tell you that in developing countries, that's not an easy task. First, in parallel, the government was deciding which were the COVID hospitals, because normally the people in the health area are separating the hospitals that are treating COVID diseases from normal diseases to control the spread of the disease. And one thing that we see is that there were some hospitals that were provided through the network, but others need to be provided through water tanks. And we need to put in place a practical program to have the names of all the people, the telephones to provide the water, and to clean the area of the door, because when you arrive to the hospitals to deliver the water, there are lots of vendors, lots of people in there. So we put in place that kind of procedure. We reviewed that all the hospitals were receiving chlorine with at least 0.5 milligram per liters of free chlorine. This was not the case in all, so we help the hospitals and even the water utilities to ensure that all the COVID hospitals were receiving well disinfected water. The second issue is that we thought that people will be washing their hands, cleaning themselves, cleaning their clothes more often. That would be implying a higher water demand. But to our surprise, that was not the only issue. We found an increase on water demand of 20 to 50% in urban areas, but the main concern was that the geographical water demand was changing, because now people were living in homes, and also the time demand. You know that normally in the morning, the water demand is higher and it's reduced while we are at work. But since we changed the places where people were staying, and we changed as well the time that people were working, this was a challenge for all the water utilities that need to readdress the way in which they were operating their facilities. That was also addressed. I'm not going to go in through that. A second issue we found, and that was very interesting, is the energy water link. I know we have been speaking about this energy water link in an international level, but maybe in a very conceptual way. The question are two in here. If people have less money, because this crisis is also making people earning less, they are having less to pay the water bills. if they pay the water bill less, in some cities, in some areas, the income for water utilities was reduced of 50%, they were not able to pay for the energy bills. And if you don't have energy, you don't have water. So that was also another thing to address, trying to set up agreements between the water and the energy sector, which was not easy here in Mexico because we have another issues in there. But that was another thing to be solved. Also, the need to provide, we also put in place a program to provide water using water tanks to poor areas in cities and in rural areas. Here in Mexico, as in many cases in other parts of low-income areas, the poor people live in highlands because these are less best equipped. So first we thought that we should be bringing more water tanks to this area, but it is very expensive. Water is very, very heavy, as you know. So we compared the use of disinfectant gels and the use of water. So we are providing water to these people to drink in small amounts, and we're providing them better disinfectant gel. Why? Because 1 cubic meter of water allows you to wash your hands 200 times, while 1 liter of disinfectant gel allows you to disinfect your hands 1,000 times. So it's much more cheaper. Another thing, and please remind me when the time is over. We also went to drinking water plants. This is not our function. It's normally the health people who assess if water is well disinfected for all the population, but we put in place as well one plan to check that all the drinking water plants were disinfecting in a correct manner the water, and that also worked. In rural areas, we also provide chlorine tablets to help people to disinfect their own small jars of water, but we need to work producing information in several languages, because here in Mexico, I think is one of the most rich countries in native language. We have around 100, 120. So we produce different booklets in, we have now 20 languages, and also we did something only with diagrams. Also, because people, even if you have this lockdown situation, when people are poor, they are still going out. So that is one thing that will happen, and is happening in many parts of the world, because people need to go out to earn money. So we put equipments to, mobile equipments to people to wash their hands in public areas. For this, the private sector help us. They are not very professional, if I may say, but they are working very, very nicely. And we are moving these equipments to different sites, because Mexico is a quiet, big country. So one thing that we are seeing is that some countries are at the higher, some cities or some rural areas are at a higher risk, while others have lower risk. So you can move all these devices.
Perhaps you could conclude soon, Blanca, because we are running out of time.
Okay. And the last one, I was going to go to the last one, is that we are asking, even if you are experiencing a high demand of water at houses, the industries are not working, so they are giving us their water to give this water to the people. So these are very practical issues, and well, with that I conclude. So the risk to catch the COVID-19 through water are low, but still you need to take care of providing water to people. With that, I will end. Thank you.
Well, thank you so much. I think one of the lessons what I think we could learn from Blanca's presentation is indeed where the risk is through social context and through social context when it comes to water, and particularly in developing countries when there is one well where they are gathering around. Although these issues are important in industrialized, in developing countries, but they are equally important in the industrialized countries. So I would like to move over to Joachim Giacomoni Vincent, who is the head of the public relations in the Greater Paris Sanitation Authority. And the question which I would like to ask, or rather pose the questions, that what were the evidence of pandemic spread through water in Paris, France, if there was any evidence? And the other one is that how would you monitor in the context? I mean, in Paris, the water and sanitation services are extremely well organized. Whether you quantitatively monitor the COVID genomes in wastewater. Joachim, up to you.
Yes, thank you, Andras. Just before, hi everyone. Thank you to UNESCO for its invitation to participate in this video conference. And I'm very proud to be among you for this important subject of water security at the age of COVID-19. Just before, let me say a few words about the SIAP, which will already be in itself a beginning of response. The SIAP is the Greater Paris Sanitation Authority. This is a public authority. It transports and treats wastewater for 9 million people in and around Paris. It treats 2.5 million cubic meters of wastewater each day. You will admit that it is therefore the perfect tool to tell if the COVID-19 is present or not in the wastewater. Well, actually, the sanitation network behave like a large intestine in the urban area, as an extension of the human metabolism. Our treatment plants have always been the reflection of our consumption and the health of our society. So we can find traces of drugs and viruses, and there was no reason it should be different for the presence of COVID-19 in wastewater. At the end of February, researchers from SIAP laboratories are already observing traces of virus in large quantities in the wastewater from treatment plants that they have decided to test. Evidence that SARS-CoV-2 excreted by patients in their stools is already actively circulating in the population. Over the weeks, the positive signal quantified by researchers of SIAP have stuck to the evolution of the cases. Works showed for the first time that there was a correlation between the state of health, that is to say, the number of people hospitalized, and the concentration of virus. It means it's also that this was a real alert system. As part of a possible restart of the pandemic, we should review an increase in the viral load in wastewater. The explanation: many sick people are asymptomatic. The estimate ranges is from 30 to 80%. And among them are the pre-symptomatic who are carriers the virus. The asymptomatic will participate in this strong signal, and we will be able to detect those who are at the very beginning of the disease. As I said just before, it will be an alert system allowing a very precise identification of the new clusters. That's why SIAP participates in a scientific program called OBEPIN with INSERM, the University of the Sorbonne, and the Water of Paris laboratories, whose objectives are: first, to optimize the procedure for quantifying the genome of SARS-CoV-2 in wastewater, in particular to lower the detection limit and develop simple and inexpensive methods of analysis. Secondly, make the link between the quantity and the epidemic level of the local population, the number of people who are infected. Third, have an early warning system during a possible resumption of the COVID-19 epidemic on French territory, but also in the event of future pandemics on the same virus or another one. And to assess the real infection nature of the viral genome detected in water and sludge and their fate during the stage of wastewater treatment. Well, the calendar is very short because we want to set up this observatory to anticipate a possible second wave. I said inexpensive method just before. The researchers have made their calculation for 1 year monitoring plan as a first intention. The bill would be between 3 and 3.2 million euros for between 3 and 3.2 million euros. This is only 10% of the price of a massive PCR test campaign per week. Useless to specify more than advantages of this result for a great number of countries, and in particular for the megacities, which could avoid wide and economic destructive confinement. It will also be one of the responsibilities to share this research with countries that cannot carry it out. Well, that's all that I have to say. Thank you.
Thank you so much, Joachim. We heard the case of a highly industrialized country and its capital, Paris. They have the means, they have the knowledge, they have the capacity to deal with this issue. So let's move on now to a place where all these issues are not necessarily given, or all these resources are not necessarily given. And the case here is India. You know, more than 1.3 billion people on that area is a huge task to manage not only the pandemic but also water as such. So therefore, I would like to invite V.K. Madhavan, who is the Chief Executive Officer of Water Aid India. Madhavan's field is water, sanitation and health, and how they are interconnected. So perhaps the question we would like to ask is that what is the role of access to safe water, which is a very important notion ever since the beginning of the SDG process. So what is the role of access to safe water in a pandemic situation such as India? How do you make sure? I mean, people are gathering around public wells. Social distancing is very, very difficult to keep, if at all possible. And yet, what we see, except from Mumbai, where we have seen some rather worrying data yesterday, the situation with COVID-19 seems to be under control. So, Madhavan, we would very much like to have your comments in that regard. Please go ahead.
I think one of the things that we should recognize is that if there is a silver lining in the dark cloud of COVID-19, the only silver lining actually at this point of time is the fact that it has brought a focus on hand hygiene. And there is a widespread recognition that hand hygiene is a crucial line of defense to protect yourself from COVID-19. You know, just as a context, I think it's important to recognize that almost 40% of the world's population, or roughly 3 billion people, lack access to basic hand washing facilities at home. And there's another billion of the world's population which has partial access or uncertain access to water, even if they have a pipe water connection, because of irregular supply. And then we have almost 1 billion people living in slums or informal settlements for whom, at the best of times, access to safe water is a challenge. In India, I mean, we talk about roughly 600 million people for whom who face a high or extreme stress with regard to water access on a regular basis, and not just in times of COVID. If you were to look at pipe water supply in a rural context, our coverage is only 18% of households which have access to a pipe water connection. There are estimates that suggest that if we continue with business as usual, then we're likely by 2030 to incur a 6% loss to GDP. So there is a compelling business case to sort of invest in provision of safe water, even without COVID-19. I think it's important to recognize that, when there's been post-COVID with the lockdown, it has been far easier to meet the requirements because major sectors of demand of water, agriculture, industry, the demand has actually been far less. And so the availability of water that is there, those who are fortunate enough to have access, are still able to get adequate amounts of water. But this need not hold true once the lockdown eases and the economy starts picking up. Deepak talked earlier about the challenges of provision of water, particularly for the urban poor. It's important to recognize that a significant proportion of the urban poor reside in settlements that are not legally recognized. And so if you live in a settlement which is not recognized by the state assumes no responsibility to provide you with basic services. And that is a challenge that exists even without COVID. But you also then have the reality that you have people living in poor settlements who are living cheek by jowl, very little physical space. Physical distancing is completely impossible to imagine. They have no storage space for water. And a large proportion of them are essentially dependent on community standpoints to fetch water, which in itself could become potential sources of infection, not because the water is contaminated, but simply the water points, the taps itself could be potential sources of contamination. I think it's important to recognize that the water crisis existed prior to COVID. What it's made very clear is that inequities in access to water prior to COVID have just rendered large sections of the population even more vulnerable now than they were before. I'm going to quickly try and focus on some of the things that we need to do in the short run and potentially in the medium to long term to try and start to address this issue. In the short run, we need to look at emergency water supply, both for the urban poor and also in rural areas, which is that if you want hand hygiene, you're going to need access to water, and therefore you need to look at emergency water supply, even if it's necessary to transport the water through tankers, but you need to get the water out there. The second is that on a priority, we need to start to restore broken systems where possible at a low cost to just get them operational. Because in addition to COVID, we're also dealing with peak summer. It's 45, 46 degrees centigrade outside. So in any case, water requirements now have gone up tremendously. So we need to restore broken to retrofit infrastructure and deal with those. Quarantine centers where people are being placed, healthcare facilities like Blanco talked about, also to look at potentially schools. And then we have a host of issues that we need to be looking at in the medium to long term. One is that we should recognize that the experience suggests that it's important to follow the principle of subsidiarity. It is best that you have empowered institutions at a decentralized level that can manage this. It is impossible to ensure safe, adequate water through large command and control systems in a country the size of India. And so it's important to recognize that institutions at the lowest level are empowered and are invested in to be actually able to operate, manage, provide services. The second is we need to get the pricing of water right. Unless people recognize the true value of water, they will have no incentives to conserve it or even to use it judiciously. The third is that we need to invest in source sustainability. If you look at why, the two major reasons why drinking water systems tend to collapse, it's one, either because they have poor operation and maintenance, or because the source itself is not sustainable. And to ensure that the source is sustainable, we will need to invest in the medium and long term on recharge of groundwater, treatment, recycling, reuse of wastewater, rainwater harvesting, and potentially restoration of lakes, tanks, and ponds. You can't do any of this without fixing the big elephant in the room, which is the demand side for water. And in the Indian context, it is agriculture. Almost 89% of our groundwater is used by agriculture. And unless we invest in water use efficiency, we're not going to be able to free up enough water for use by other sectors. And lastly, we need to start to reimagine our cities, to look at urban settlements differently, particularly settlements of the urban poor and how we provide water and sanitation services. Because what's become very clear with COVID is that a disease that was actually transmitted by those who came in who were well off and could fly in from other parts of the world, have now transmitted the disease to the urban poor. And the urban poor have no physical space to be able to deal with this issue. And so we need to start to look at the provision of services to them very differently and to possibly reimagine settlements for the urban poor. Lastly, we need to invest in safe water, not just because it's required for COVID-19, which is for greater hand hygiene, but we need to invest in safe water to ensure that public health itself can benefit from it. And for that, water needs to be a political priority. We need to prioritize water which is safe, assured, accessible, and equitable. Thank you.
Thank you so much, Marhaban. I think what you brought up so far was not very much discussed in the debate, namely the position, or rather the situation of the urban poor. I was not long ago in Bangalore, in Karnataka, a city which is extremely fastly developing. And soon it will be 20 million people. So it's such a huge concentration of humanity in one place that it is inevitable that COVID-19 and other type of viruses may cause disruptions, even even social disruptions. And as you pointed out, the importance of water in the SDGs being the centerpiece of the Sustainable Development Goals. That brings in the global dimension. So in the next two presentations, we would like to concentrate on the SDG related issues, sustainable development. We will have a question also here for the public. Well, that's exactly what the feeling of the professional community is, that water, 62% of the people responded that COVID-19 could not be, it's not spreading through drinking water. So that's very interesting. But that moves us on to the next issue, which is the Sustainable Development Goals, because the question here, which I would like to pose to Professor Olcay Ünver, who is the Vice Chair of the United Nations Water Committee, and formerly he was with FAO and a good colleague of ours at UNESCO. So the question here is, will the COVID-19 delay the implementation of the Sustainable Development Goals? Will those goals be achieved by 2030 as they were supposed to do that, or will it slow it down? So Olcay, the floor is yours in trying to respond to a very difficult question, that how will COVID-19 impact water security and the implementation of the SDG goals? Olcay.
Thank you, Andras. I'm very happy to be a part of this discussion, and I hope you are all healthy and safe during the outbreak. Obviously, I'm very thankful to UNESCO and Water Future. And for the question, strengthening water security is essential for combating COVID-19 and preventing future pandemics. So the response, both the immediate response and the post-COVID era, should be promising for strengthening water security. But all of this, including the implementation of Sustainable Development Goals, will be subject to a revisiting of the implementation and accelerating the implementation towards the established goals with the experience that we have now in front of us, plus the funding issues that we will be experiencing very soon. The pandemic has drawn global attention to the fact that billions do not have safe water and sanitation. The previous speakers talked about it. The first line of defense to the virus, hand washing with safe water and soap, is unavailable at home to 3 billion people. In an equally alarming statistic, a WHO UNICEF study of healthcare facilities indicated that in 54 countries, 35 failed to offer soap and water for hand washing. These are healthcare facilities that are lacking this to a large extent. Washing hands requires safe water, and industrial and agricultural pollution is making access to water more difficult. The pollution also increases the cost of treating water to safe standards. According to the UN Water Global Analysis and Assessment of Sanitation and Drinking Water, of the countries surveyed, 94% had plans in place to deliver safe drinking water and sanitation, which is great. However, less than 15% of these countries had both the funds and the capacity needed to implement these plans. So we have an issue there. According to some estimates, providing access to safe water could cost almost $420 billion a year over the next decade. That translates to 0.5% of the global domestic product. To date, the international community has not been able to galvanize the needed investments in safe water, sanitation, and hygiene. We hope that people see the importance of these investments now, when a lack of safe water causes a cholera outbreak or food shortage in a poor country. It's probably easier to look the other way, when what's at stake is a highly contagious virus capable of crossing the globe. The lack of water security anywhere becomes everyone's problem. The broader issue of public health is followed by the concern for food security and the need for the integrity of the food supply chain, starting from sustainable agricultural practices to processing, transportation, storage, and consumption, all of which necessitate water. COVID-19 has revealed our vulnerabilities. We must build resilience, and we already have an internationally negotiated framework for transformative change. That's the 2030 Agenda. And with its Sustainable Development Goal number 6, it's ambitious, it's transformative, holistic, and it's needed now more than ever. The holistic look is essential because we don't want to compromise our development objectives by addressing them in silos. It is more essential for maximizing resource efficiencies and the overall return on investment, particularly in the post-COVID era. Because of this, UN Water has developed the SDG 6 Global Acceleration Framework as a coordinated input to the UN Secretary General's call for a decade of action to deliver the SDGs by 2030. This framework has been collectively developed by UN Water's 32 members, of which UNESCO is one, and 41 partners. And as countries are responding to the pandemic, it offers a way to address the many water and sanitation related aspects with increased speed, focus, and coherence. This framework aims to deliver fast results in countries at an increased scale. It focuses on 5 key accelerators to unlock country progress on SDG 6, and these accelerators are financing, data and information, capacity development, innovation, and governance. Another key point of the framework that I would like to emphasize is that it's driven by country demand, and we help align the international community to strengthen country planning, implementation, and mutual accountability with a focus on known bottlenecks, because we know that advancing SDG 6 targets can only happen at country level. So these are all becoming even more relevant than before, than in the post-COVID era. To this end, UN Water has been piloting its offer to the UN country teams and resident coordinators, and its country-level engagement is supporting the UN development system reform, enabling water and sanitation expertise across the UN system and beyond to reach the country level. The framework that I just mentioned will be launched during the high-level political forum in July later this year. So this is basically a sort of a teaser. I mentioned earlier the 5 accelerators of this framework, and let me conclude by giving some examples from what a framework like this can do. For example, governance is a good accelerator for promoting integrated water and sanitation solutions to achieve the SDG 6 target 1 on drinking water access. Governance can play a role in developing a spatial approach that goes beyond municipal boundaries and considers effective management of infrastructure systems with focus on integrated urban and territorial planning, proper land use management, and legislation. To address SDG target 6.3 on water quality and wastewater, for example, leveraging innovation in wastewater treatment and safe use is an excellent accelerator for us to reduce ambient water pollution and improve water and nutrition availability for agriculture. And when it comes to target 6.8 on cooperation, financing and solutions on financing are definitely key. So in conclusion, the negative impacts of weak water and sanitation systems reach way beyond public health. And without immediate action, we remain dangerously vulnerable to a range of growing threats, and we cannot afford to wait. We need ambition and vision. We need to act together. And I think in the post-COVID era, both the development partners, the member states of the United Nations will see this and take the Sustainable Development Framework and the 17 goals more seriously with a resolve, a stronger resolve to implement them with specific lessons learned from the post-COVID, the COVID era response and the post-COVID circumstances that we are getting ourselves into. Thank you very much.
Thank you so much, Olcay. Well, let's see what the participants think of whether the COVID-19 will delay the implementation of the SDGs. Onik, I guess you have the statistics that we could perhaps share with the participants. Oops, that's interesting. 83% of the people, and I think rightly so, if I may share with you my own feeling, it will delay the SDG goals, and we already know that the SDG goals will not be reached by 2030. So indeed, that requires a much more intensive collaboration amongst nations and governments, and that should certainly elevate the importance of multilateral institutions, intergovernmental institutions, such as the UN system itself. If I may share with you my personal feeling, the attacks WHO is subject to is wrong, is entirely wrong, and it's irresponsible. So instead of weakening an organization, I think that organization, that particular organization, needs to be strengthened. And the whole UN system, perhaps if we have time at the end of this debate, we will come back to that, because there are some very interesting questions that our participants were sharing with us in the chat room. So that leads to the final presentation. What we have is national level. National level, how will the situation impact national water policy making, and what can we learn from this crisis? Use it as an opportunity. Spain is a country which was heavily hit by the virus. I mean, those people were, heroes, individually and collectively, to deal with that situation. And of course, for Spain, for Europe, for the whole world, water security becomes a centerpiece. The question we would like to pose to the participants, and that will be the question later on, our friend Manuel Menendez Prieto will deal with. Do you think COVID-19 will affect water security? If you think yes, then tick that point, that box. If, well, you don't think that, do the other one. So let me now turn to Manuel and ask the question is that, how do we learn from the crisis and how it can improve the water security in Spain itself? What is the connection you see? Manuel, to you.
Thank you very much, Andras. Let me say thank you to this opportunity. I'm very pleased to stay here and can exchange information with all of you. Well, we have a lot of lessons to learn from this crisis, and I will try to point out some specific points that some of them has been also mentioned by previous speakers. First of all, I would like to say that we have very few incidents in the operation of our water services. More or less, the totality, 100% of our services, water services, are operating as usual. And our main issue was the lack of PPEs and the antibodies tests, but well, you know that the market was crazy and it was very difficult to can obtain these equipments for our workers and for the water people, if you want, working in the wastewater plants and so on. Our main fears in the operation of our water services is more regarding the social and economic impacts. Blanca Jimenez Cisneros has mentioned it. People is suffering a very severe crisis that produces lower incomes and has produced an increase in vulnerable users. So the Spanish government passed just at the starting of the pandemic, passed a specific law considering water services as essential services. So water companies are not allowed to cut services for those who could not pay. So I think is an important point to be stressed here. That has caused several losses for the operators. That we have a preliminary evaluations of 20-30 million euros per month. And if you add this circumstance to the decrease in the water consumption, that in average in Spain is about 10%, but in some tourist areas is the decrease in water consumption is more than 30%, is going to produce less incomes for the operators, less incomes for the municipalities. And this is something that we have to take into account. This is one lesson that we have to take into account for the future. I would like to mention another point that is about if the pandemic can spread through water. I absolutely agree with what you have mentioned before. But I would like to stress the point that our colleague from Paris, Joaquin Giacomoni, has said. Well, one lesson I think is clear for everybody, that the pandemic was not foreseen, that we have the pandemic in front of us without any new. We are having evidence that untreated wastewater is a very good indicator of the presence of the virus in a population. And those can be used as a warning system. In Europe, there is now going on a specific project, I+D project, is called Wastewater Monitoring System for SARS-CoV-2 surveillance, that is led by the Joint Research Center of the European Commission. And in Spain, at national level, in my ministry, we are leading a specific project just to create a warning system for potential new outbreaks of the pandemic in the future. We are having several expectations that can be, as I mentioned, a good indicator for mainly future outbreaks. And I would like to say something about how to prepare for the next time. Well, in Spain, it's clear that talking about a new normal phase, talking about recovery, is talking about green recovery. I mean, for us, it's clear enough, crystal clear, if you want, that this is an opportunity to reorient our development model, just preserving better our environmental values and also increasing our resilience, because our resilience not only about the health crisis, but also about the climate change. For us, there is no doubt. We are convinced that there are strong links between this pandemic with this health crisis and also with climate change. So we are thinking in and implementing policies based in three key elements. One is push hard for the ambitious climate and energy politics. By the way, the Spanish government passed a specific law on climate change last week. The second element, key element, should be promoting circular economy. And for instance, water reuse is a key point in this promotion of the circular economy. And the third point is digitalization. Digitalization not only for, if you want, to increase people working from homes and with also environmental implications, but also in the water field to increase the digitalization of all our systems. I mean, monitoring systems, I mean, real-time warning systems for floods or other extreme events and so on. And just to finish, just to mention that this is in line with the new recovery plan that was presented yesterday by the European Commission, by the President of the European Commission. Maybe you know that is called Next Generation. It seems to me that the European officers likes a lot Star Trek series and films, and it's also based in these three elements I mentioned about climate change, about more resilience, not only about health crisis, but also environmental crisis, and promotion of circular economy and digitalization. Thank you very much.
Thank you so much, Manuel. You brought up a couple of very important issues, and en passant, you have mentioned the need for digital water resources management, and it looks now that there are new research programs that move into that area. Well, ladies and gentlemen, may I suggest that we move over to a short discussion mode amongst the panelists, because there were some extremely interesting questions. If you go down to the chat logo down there, the chat symbol, you will see all the questions and comments coming up. But here is the result. Do you think that the COVID-19 will affect water security? 85% says yes. Now let's discuss that. How do we respond to that challenge? How do we respond? Annika, I'm an amateur in handling this issue, but can we all be seen? And then I would be able to somehow facilitate the discussion. A friend of ours, a dear friend of ours, Shami Puri, put up a very interesting comment, a very provoking comment. And the comment says, with respect to the SDGs, he says, the result is not surprising at all. Remember that what we said, what the public said, and the participants said that the SDGs will be suffering from the current crisis. Not a surprising result. SDGs, or SDG, Sustainable Development Goal, is a distant fantasy for most of today's hardly responsible government. Now, how do we deal with that? If that's the public image, what do you think in terms of the UN system, how the UN system should respond, and how governments should deal with it? Both Blanca and Manuel are high-level officers, public officers in the government, but others who had earlier some career in the UN. How do we readjust our system? For instance, in the UN, do we design our programs, WHO, WMO, UNDP, UNESCO, FAO, in the light of an opportunity and a risk that, again, the COVID-like virus might come back. And as many argue, the second attack will be more fiercely. Dan, what do you think of that? What is it what you think that the UN system should do? And perhaps then we go over to Blanca to ask her view on governments. Dan?
Well, listen, I will take advantage. I'm now member state. so speak and say things differently. I'm sorry for my UN water colleagues, but for me it was clear that the SDG 6 was done much more to give work to specific organizations than to really address the people. The participation of practical people and developing world was not that much. And now I'm seeing how it is affecting the country. So for me, SDG 6 should be completely reviewed, not thinking which SDG or which target belongs to each organization, but really addressing the needs, not involving almost at all UN organizations, but only using UN organizations to facilitate, to have member states deciding. It's a strong, but I think it needs to be done with a very completely different mindset, because what COVID-19 is leaving is that we need to rethink the way in which the world has been organized economically and politically. So that needs to give a different approach. Wow.
Yeah. Well, you know, in principle, you as a former UN officer, myself as a former UN officer, Youssef, who is carrying now all the burden of that, we all know that, you know, the UN is providing a framework within which the government should come to an agreement. So the UN is not the one who dictates.
But for
Therefore,
me,
go ahead.
It was a manipulation in many cases. And I need to say that now loud.
Look, there is manipulation today by some governments with respect to the UN. Those who would try to play down the role of the UN, those who try to say that the WHO is a bad guy, those who try to say that WHO didn't do the job. I think WHO did a magnificent job. And the whole thing became, you know, a toy, if not a tool, in the hands of some of the bad characters. But that's my personal opinion, which I can say because I'm a university professor who is free. So is Dan. Dan, what do you think of this? What is it? How should the UN, for instance, the international community, how should it respond?
Well, the perspective that we've been promoting for about 25 years now is that we can switch from crisis response mode to being proactive if we want to. But the impulse for business as usual, the impulse for crisis response, being heroic and then waiting for the crisis to end and then hoping it never happens again, that's very strong, and it's very deeply embedded in both public and agricultural health practices. And in those areas, especially in public health and medical health, there's a philosophical guideline called first do no harm. And this is fine as long as there's no climate change and there's no change in the basic landscape of disease, because everything's predictable. Now nothing's predictable. Do no harm becomes a prescription for wait until there's an outbreak and then rush to try to deal with it. And that we know that that's unsustainable. It's already prohibitively expensive. And it turns out that we can do better than that. But it requires a very different mindset, a very different perspective on things. It requires that we start looking at disease in terms of evolutionary biology and basic ecology, rather than thinking that disease organisms are things that were somehow magically created just to cause human beings harm. There is a policy, as you know, Andras, we have a general policy mode called the Dhamma protocol. And this could be implemented. It could be implemented. It can be scaled up from the ground level up. It's a very grassroots oriented sort of thing. Blah, 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 blah. It's out there if people want to try to be proactive and get ahead of this problem. But we're running out of time to try to do that. And at this point, many of my colleagues in that area of climate change and disease believe that we are at a point where no matter what we do from now on, we've already let this go so long that we are in triage mode. And that anything we do from this point out is going to be trying to make the best of a bad situation that we should have done something about. We had the ability to do something about many years ago, and we just let it go.
Yeah. There is one question which I think is addressed to all of us. And that's where I have to admit the scientific community is rather poor. And that's the communication. How do we communicate the messages in a well, simple or simplified way, if you wish, but still in a meaningful fashion? A, to the public, and B, to the politicians. Because I had the feeling in this debate, some said the politicians said things which were completely silly. They were not really aware of, fundamental scientific facts. So who would like to come in and communicate and say a few words on the importance of communication? How should we change that?
Yusuf,
Yeah, shoot, Anik, shoot.
no, I'm saying, Yusuf, do you want to say something? Yusuf? Yes.
Yeah, poor thing has been provoked. So we talk about communication. And what is the role of, for instance, UNESCO, that stands at the crossroads of education, science, culture, and communication? How can UNESCO help in that regard? I know it's a $60,000 question, but still go ahead.
No, I think you're right. UNESCO has a broad mandate in the sense that it includes science and education, and it's a mandate given by the member state. I think in the sense of the in communication, that you were the Secretary General of the IHP and also the Director of the Water Division. That our role is to play that link between scientists and the policymakers. It's not an easy task. It's it's another way of communicating with the policymaker. We need to make the information more easier for them to understand, but also to communicate on. It's not all. It is not always the case, and in some cases, as you mentioned, the messages are transformed. Not necessarily by wording, but by not making, or by not understanding the difference between the wordings sometimes. So yes, it's needed. It's a huge mandate. It's not always easy to get the right message through the policymakers. But yeah, it's I think everybody needs to work on that.
Yeah, well, I guess that at the next council session of the Intergovernmental Hydrological Program, probably the issue will be brought up by governments and NGOs, that perhaps we need to retool and readjust our science programs. Dan was making a reference to the absolutely fantastic and fascinating program and progress that we had in data collection systems, in communicating systems, in satellite application, in modeling. We can almost compute anything. It's a matter of will. But I see now Deepak, he wanted to add a comment. Please go ahead, Deepak. You are unmuted. Or you are muted.
Yeah, okay. Sorry. I think the time is really stop treating politics as if it is only government and ministries' responsibility. That is important, but let's not forget, businesses also do politics and activists also do politics. As a result, water has this whole wide link of chains in politics, in the supply chains and everything at every point, where some pretty strong positions and entrenched positions are being defended or attacked. Okay? So I think as water people, what we have to really do is realizing that international level SDG politics or anything else, they're important, but to realize that we have to take our politics away just from party politics or government, addressing government policymaker politics, to actually also talking about the kind of politics that activists and very powerful business interests are also pushing. So this is where the pitch, I think, to me, lies.
Yeah. Okay, I think we have to converge to a closing, but let me share with you one personal pain I suffered over the past 3 months. Perhaps I'm genetically badly coded because the UN is all in my blood cells. But when I learned that there was a major country that reduced the WHO budget by $500 million, I thought, what the hell is going on? Just the opposite should be done. Particularly, perhaps our viewers don't know that the budget of WHO, the World Health Organization, is smaller than a medium-sized North American hospital. The number of officers in WMO is less than the policemen in my own little capital, Budapest. So what are we talking about? That is an institution, and the United Nations system as well, that needs to be reinforced. Because this COVID-19 crisis has shown again the interconnectedness. We are all connected. No government alone can ever solve this problem. And those governments who are just walking away from the responsibility are irresponsible. That's my personal view. Anyway, let's make a last round. Blanca, please go ahead.
Well, I think that the way for me to go is to go intergovernmentally in the water issue and linking the governments, member states, to scientists and to the knowledge. It will be a way to see things differently. So for me, that's the way to go. And in that respect, ISP has a very, very key role to play. But you need to mobilize people. I think these electronic issues make things easier because everywhere there is a problem of money. So organizing intergovernmental meetings with the scientists, social and technical, would be the way to go, and to rethink that SDG 6.
Okay, thank you so much.
Can I react on that? Just, so yeah, it's, that was, I think that's the way to go. I think that the COVID brought to our attention once again the necessity to move from the local or regional perspective, or snapshot, as we call them, to looking at the global picture. Because it's a transboundary, issue. It's not anymore, about, water quality in a country, but it's more than just that. So for that, there is a huge need to close the gap between the scientists, researchers, and practitioners from different worlds, because I call them, different worlds, because they don't have the same means, not the same, tools, to combat that. And for that, I agree with Blanca that it has to be intergovernmental. It has to be, through multilateral cooperation and not only, bilateral cooperation. We need to bring, those scientists at, at almost the same level, so they can exchange the information, which is, basically what you mentioned, earlier. There is now, a very big space for open science, for open tools that, people can use, to get together, like we saw during the COVID, through all these platforms, discussing and exchanging the information and the data. So they can be at the same level of, information and exchange that information, so we can, combat whatever, pandemia or next pandemia, as, it was mentioned earlier.
Okay, all right. Well, thank you so much. Before we close, let's make a last round. Everybody has 2 sentences to say. The way ahead. what would be your recommendation after this fascinating debate? Into what directions we should move, and what are the two most important actions we should take, considering your own area, considering that you come from different sectors of society, from NGOs all the way up to academia and government. So what is it what you think are the two most important things to do? May I start with Dan?
Other than what I already said, we should
two sentences.
We should move from crisis response to proaction. We need to anticipate to mitigate, and we can.
Good points. Blanca?
My 2 points is that after COVID-19, we are different. The world is different. We need to have a new SDG on water, different.
Okay, that's cool. Joachim?
Well, we could not find alone. So the first sentence will be, we could not find alone and we have to share. And the second sentence, before the COVID-19, we have to speak, and don't forget, we have to speak about population, because the common point between everybody was the population for the disease. Yeah.
Well, that's the right point, all the more so, as in 30 years' time, there will be 9.3 billion minimum. So that's a huge issue. Deepak?
I basically think that this is pointing us to the fact that we need to train upcoming generation of water experts in more transdisciplinary approaches. We are getting them to be highly silofied and unable to think outside of their own boxes. So this is a bigger problem for now, training new generation of water managers.
Right. Okay, Manuel?
Mute. Unmute.
Sorry, I would like to point out that, well, now we have in the recovery phase an option to rethinking our development model. I think that is one point I would like to stress. And that in some sense, the debate, the discussion between economy, environment, and health, in my opinion, has no sense. It's a very artificial debate, and we have to take into account all economy, environment, and also this health crisis in a very holistic way.
Right. Thank you. Madhavan?
I think in 2020, we can't be looking at community-based water provision. The normal has to be pipe water supply in every household, rural or urban, rich or poor. We can't be looking at 2020 or in the future at community standpoints. The second is we have to invest in the leadership of women. I suspect that if the men on this panel had to go and fetch water every day, we would have been clamoring for pipe water supply at a household level 20 years ago. Right. It's about time we recognize that women have a significant role to play in the provision of water for their families, and maybe we should invest in their leadership to help find community-based solutions.
Well, that's absolutely true, Madhavan. We made a big pledge way back in 1992 in Dublin, calling the attention to the importance of women in water supply. Not much happened, frankly speaking. So that's a good point. Yusuf?
Well, I would plead, again, for, exchanging, the information, through the open science and, the available, tools that we have. Although, I'm still, not, I will still, emphasize that, there's a big discrepancy in times where we are talking about, platforms, exchange of information, e-learning. There's still, discrepancies between, countries and regions, basically. If we look into the number of the users of the internet in Africa, for example, it's not more than 28%, while in Europe now, 82% of the people have access to internet. So if we want, to get into that discussion, or more, let's say, equal discussion globally, we need to look into also those discrepancies that we have.
Absolutely. Now, I'm looking for Onik. Onik has disappeared, or hasn't disappeared, but he's in the background. Because I would like to ask Onik to share with us what shall we do at the Sustainable Water Futures program, which is a part and parcel of the Future Earth program. How should we perhaps retool our research programs? Onik.
Unmute.
Unmute.
Hello.
Yeah.
Yeah, COVID-19 has impacted our research terribly, our field research, implementation programs, and so on. This will be it will be a new mode we have to function, as many of you has mentioned. And right now, one of the thing is how we can accelerate the implementation of SDGs. And science can play a role there also in understanding how we can sequence different types of investments, how we can prioritize our actions, and through assessments. I think where Sustainable Water Future programs can play a role in supporting many of the UN organizations, and also collaborating with UNESCO and other UN organizations. I see that way.
Thank you, Onik. I think with that, perhaps you ought to close now the discussion. We can go on for hours.
Yeah, I want to thank all the panelists and all the participants. I want to thank the moderator. Thank you, Andras. I want to thank our UNESCO colleagues. I want to thank Yusuf. I want to thank Anil also for supporting this. And this is our first discussion series. And there will be other discussions going on as part of this series. And we all want to have you also be part of this as participants. And there was some kind of hitch because of technicalities, many people cannot join this webinar, and so hopefully we will fix that problem next time. Yeah.
Okay. All right.
Anik, so
yeah.
I just want to emphasize for those that didn't, take note. This is a series of webinars that Future Waters and UNESCO will be organizing. And the next one, as you know, we agreed with Anik, will be hosted by UNESCO. So keep in touch. So we can also involve you in the next ones. And thank you.
Yeah.
Thank you.
Well, I think this is the time to thank everybody who contributed, and I would like to call your attention to the question and answers at the chat room. We had some fascinating questions. So if you can pick up some that are related to your work, and then start and continue the dialogue, that would be great. So this was the first webinar indeed between UNESCO IHP and the Sustainable Water Future program, which we will continue. And I hope we will have some special sessions on Africa, because we haven't talked about that in a greater distance. And next year, we will have a huge conference in Brisbane. And I hope that we will be able to see you there. I would like to thank the participants for the extremely interesting questions. And with this, thanking you all, I would like to close the session.
Yeah, I want to thank 3 other people also from the team who has also worked for them, Aditya Kaushik, Kosun, and Asil from the background, and for supporting these things.
Okay.
Thank you.
Bye-bye. Thank you.
Bye, everybody. Nice to see you.
Great to see you guys. Thank you. Bye.